Hey Shauna, just like it sounds, I field questions from the tribe, and they usually start the question with the words, "Hey Sean." Semi-quick question this morning. Had a question from a seasoned nurse who's a bit concerned. Maybe we should just flat out say it. She's a little scared. Seasoned med-surg nurse who just started in the ICU. Little scared. 6 years of experience on the floors, just finished orientation, and she feels horribly unprepared. Horribly unprepared and not confident in any of her skills taking care of the ICU patients. This person also feels that the nursing staff, the physicians, quote unquote, pick them apart every day. And lastly, they feel that their preceptor for their ICU orientation really didn't teach them much. I'm going to address the elephant in the room, and let's talk about confidence. Anytime you embark on anything new, you're not going to have any confidence. And while you have experience on the floors, you have no experience, zero experience with taking care of the critically ill ICU patients. So one could argue that you don't have any experience at all, because some of your floor experience is going to help you with some of your tasks. This is not to say that 6 years on the floor does not help you. It does. But when you walk through the doors of the ICU, it's a completely different world. Basic nursing skills that many will struggle with, you will not. Having to give medications, physical assessments, communicating with the patients and the families, therapeutic communication, and continual communication, anatomy, physiology, lab value interpretation, prioritization. All these things are not going to be difficult for you. The problem lies in the intensity dial. It's going to be turned up from a 1 to about a 12, if you know what I mean. So I think part of the problem is you've probably assumed that you would have the confidence because you got 6 years of experience, when in reality you don't have any confidence. All of this is completely normal. Let me say it again. Completely normal and almost expected. The only way anyone gains confidence is by doing a thing over and over again until it becomes not only rehearsed but reflexive. You are experiencing things for the first time that you probably may or may not have heard of or seen while you were a student nurse. And I'm willing to bet you can agree that your life 6 years ago as a student nurse is very different than your life now. Confidence is not something that you can just pull out of a box. It's not something that's sitting in your work locker. It's not something you can find on the internet. It takes time. And it's surely not something that someone from work is going to give you, bestow upon you. It's not something that you cross the threshold after orientation and voila, you got it. It took me almost 2 years of practicing at the bedside as an ICU nurse before I felt confident, be able to use the word confident. So, with 6 years of experience, I would expect it's going to take you 6 to 12 months to gain confidence. Especially in the ICU. I mean, nobody understands how difficult the ICU is until they're there. One of the hardest parts about gaining the confidence is feeling like you're alone. And I want you to know you're not alone. I will guarantee anyone that watches this will gladly agree with me. Anyone that has gone through the ranks in the ICU, through orientation, they can agree, they can attest to how this confidence takes time. Actually, let's ask the tribe. When you finished orientation, were you confident in your skills? Yes or no? Okay, that's the confidence thing. You're just going to have to give it some time. You're going to have to bury your head, learn as much as you can, become a sponge. And one of the hardest things that many new nurses in the ICU have to overcome is asking for help, understanding you are not going to know it and you need help. So that brings up the touchy subject of feeling, like people aren't supporting you, or you feel that they're quote unquote picking you apart. Here's where I'm going to sound a little mean. Here's where I'm going to sound a little obtuse. You need to suck it up and grow a thicker set of skin. Suck it up, put on your big girl panties, and deal with it. And I don't mean go cowering into the corner or starting to feel self-pity, wallowing, and oh woe is me kind of attitude. Put on your big girl panties, put on your flak jacket, arm yourself, and attack. If you truly want to be an ICU nurse chews on nails every day. The ICU nurse is often the last thing standing in the way between your patient's life and death. You are a lifesaver and risk taker. It's time to step up your game. Advocating for a human being at their worst moment, at their most vulnerable moment, when they are dying, is a difficult job. So many ICU nurses have to dig deep, step up their game, and rise to the challenge. This shiz is hard. Not everybody can do it, but that's the whole point. That's why ICU nurses are so unique and special, because not everybody can do it. And now you get to decide if it's for you. You need to step up your game. You need to start demanding to learn what you need to learn. If they truly are picking you apart, why are they picking you apart? Is it something that you're doing? Is it something you're not doing? Or is it a personality problem? Personality problems you're just going to have to deal with, because we have a lot of life suckers in this world, especially in our profession. Yep, there's mean doctors, there's a-hole doctors, mean a-hole providers, mean a-hole nurses, leadership, co-workers, they're all there. You get to decide if they become a roadblock to your profession or just an obstacle. I would openly communicate all of these things to the people that make you feel this way. Don't go to your manager, don't go to leadership. Directly confront and talk with these people that make you feel this way. This is not a high school schoolyard. If you have a physician that's making you feel inferior or making you feel bad or picking you apart, ask them why. Same thing goes for any nurse, any colleague, any other part of the healthcare team. They're making you feel this way, you need to dig deep and deal with it. I would also ask other coworkers, are they feeling this way? Are you the only one feeling this way? Is it a singular incident, or is it a common theme on that unit? If it's common theme, then that's a bigger problem that you're going to have to deal with differently. But in the meantime, you need to grow as a new ICU nurse. And that's a whole nother conversation, so we'll table that conversation. And lastly, I think this person asked about report sheets. I would check out the internet, search brain sheets, or search cheat sheets, or search report sheets. There are a lot of free stuff out there. Way back in the day, I actually created my own. I may still have it. Might be difficult to find. You got to remember, it's been over 5 years. All right, tribe, what'd you think of that one? What'd you think of the question and my answer? Do you agree? Do you disagree? What do you got to say about building the confidence? And as always, if you like what you saw, don't forget to head on over to my YouTube channel. It's where I post all of my answers to the Hey Sean questions and a bunch of other videos. And yeah, I gotta be a little annoying. Don't forget about the new website that I have coming out probably in a couple weeks here, freshnp.com, where we are going to dissect and help anyone who's interested in anything about being an NP.